ये मेरे को डायरेक्ट पी दबाना ना, लिखना है तो
हाँ नहीं, कंट्रोल पी
कंट्रोल पी, ठीक है स्टार्ट करो।
लिखना है अभी।
हाँ मैं लिखते लिखते पढ़ा था, पॉइंटर की ज़रूरत नहीं है मेरे को, चलेगा ना?
हाँ चलेंगे, जैसा आपको
हाँ ठीक है।
स्टार्ट कर दो।
Hello friend, myself Dr. Mohammad Ismat. I am Chief Medical Officer. Today the topic of the lecture is disaster management. So what is disaster and how cut कर दो यार, sorry.
नहीं
ठीक है. So today the topic of the lecture is disaster management. So ideally the clinical practice, there is one-to-one patient or multiple patients come in casualty, but for the disaster management the ideal should be the mass casualty. The patient should be more than 10 patients to be considered as a mass casualty. And here what is code yellow? So code yellow is nothing but to provide ठीक है, एक second. So what is code yellow? Code अरे रखना पड़ेगा, एक मिनट। हाँ सर मैं लेक्चर ले रहा हूँ सर। हाँ लेक्चर ले रहा हूँ सर। ओके
कौन सा है?
मैं साइलेंट कर देता हूँ यार। So what is code yellow? Code yellow is to provide the comprehensive plan when patient load for exceed the capability of emergency department to provide emergency care and arrange additional resource for providing care to large number of the victims. Okay, so code yellow will be announced from casualty by dialing 300.
जम मत करो उसको।
अच्छा अच्छा, उसको पॉइंटर को जम नहीं करना ना। ओके
वापस से start
ठीक है,
करो।
मैं स्टार्ट करता हूँ फिर। सो व्हाट इज कोड येलो? Code yellow is to provide the comprehensive plan when patient load for exceeding the capability of emergency department. So to provide the emergency care and arrangement of additional resource for providing care to large number of victims. So code yellow will be announced from casualty dialing 300. ठीक है,
पॉइंटर ऐसे कर डालो, पॉइंटर ऐसा ऐसा ऐसे उठा के ऐसा मत रखो, ऐसा देन ऐसा।
मैं इसे पेन से लिखा तो नहीं चलेगा क्या? मेरे को ये एक्चुअली ऐसा पॉइंटर से ज़्यादा अच्छा तो पेन से लिखा था। ठीक है चलो कोई बात नहीं। So once the code yellow has been announced and once the doctor, the casualty has saw the patients are coming more than 10 patients and he saw that okay, there is a mass casualty and he needs of help. So in that situation, the emergency department, any staff, the sister or the doctor should call 300 and announce the code yellow. Once the code yellow has been announced, the situation in the hospital is bed in ER should, in our hospital the bed is ER is 5 and OPD beds we have 5 and the place of the cadaver, the assembly point which sorry यार, assembly point में नहीं रखा हमने cadaver का, हमने रखा है इधर वैक्सीन रूम। जानते हैं अपन असेंबली पॉइंट ही बोलेंगे। ऐसा कट कर चलेगा या एडिट हो जाएगा ना? सो
वो पॉइंट रिपीट करो।
हाँ, the place of the cadavers are assembly point, communication with and among the ambulance. So this point is stating that not only the communication with our ambulance in our hospital, but the ambulance towards the other hospitals or the ambulance which are free, and the hospital security system should be communicated well. Here the thing is that we need to control the crowd. Later on we will study in the lecture that how we control the crowd, what are the responsibility of each the department in code yellow. And there is a triage system and disaster plan should be managed by the clinical team, and medical supplies and communication should be done by PRO team and the biomedical team. So the content of the code yellow is that hospital responsibility, which we have already discussed, and that there will be a triage nurse and there is a responsibility of her also there as the doctor in charge who has triaging the patient. Same he will guide to the nurse who is applying the bands like black, yellow, green. We will study in later on. So the nurse that nurse is sorry. So the doctor has been advising the sister to apply the bandage of the triage which are red, green, black and yellow, which will be discussed in later of the lecture. And the third one is the trauma team. Trauma team will be decided by a chief medical officer or a chief intensivist or a casualty medical officer. And emergency preparedness, which we'll discuss in later on the subject. What are the emergency preparedness are there, and the use of triage in the hospital bed and post disaster action. So hospital response, like what are the hospital response? Patient should be what are hospital response? There will be a notification to all the staff, all the members in the hospital who are all the HODs, and the preparation after the notification, the staff should be start preparing, arranging the beds, arranging the medical equipments and receiving the casualties. When see in the photo, they have started receiving here. So you can see here how they are managing, how they are receiving the casualties. The preparedness is equal to the receiving, means once you start preparation, then you will be in a program to start thinking that the casualty should we should receive the casualty. And fourth is the stand down, fifth and sixth is the fifth is the fourth is stand, okay, fourth is the stand down and fifth is the pharmacy, and the sixth is HK and biomedical team. These all the teams like biomedical, HK, pharmacy, stand down, all should be prepared when the code yellow has been announced. The each department has their own responsibility, which we will discuss in later on the lecture. So once the code yellow is announced, the in charge of the casualty should empty and expand the hospital. And empty and expand is in the sense that the common cases, the normal cases, we can shift the patient to the other department or shift the patient to the respective floors, and we should prepare for the empty beds. Existing patient mobility, transferring the patient and postponing the elective surgeries. We can postpone them because there is no any emergency to it. For that we can get the beds. And additional staff like staff as per duty and managing the voluntaries. Stock all the necessary medical supplies, inform the blood bank, and to list to be maintained, and medicine like code yellow's medicines kit will be checked for expiry on the monthly basis by the pharmacy department. So this point is that कि ये हम हिंदी में बात कर सकते हैं इसको, है ना? तो द थिंग इज दैट कि मैं फिर से बोलता हूँ ये, ठीक है. इन्फॉर्म टू द ब्लड बैंक and list to be maintained and medicines. So here the list to maintain, the staff nurse should maintain the medicines of code yellow to be differently in the casualty, so that if the mass casualty occur, so this medicine is solely taken from that place only. So crowd controlling is done by a security team. Here their responsibility is like the managing in collaboration with security and other volunteers. The main hospital gate should be closed and only vehicle and individual carrying casualty should be permitted. The role of admin executive, fire safety officers and the front officer. Establishing communication with external agencies like other government and private hospitals. Arranging of the ambulance from outside in case of shifting the patient to other hospitals, to be done by administrative executive. And about the security, it's already told you about the crowd management, and front office people should list out the other hospitals number and ambulance services, blood bank phone numbers and police station to be maintained by the admin executive and front office. Role of housekeeping. अरेंजिंग ऑफ एक्स्ट्रा, ये जो मतलब बोलते हैं ये नहीं बोलना चाहिए ना, है ना? चलेगा क्या? रोल ऑफ हाउसकीपिंग. Arrangement of extra staff for mass casualty and to train the staff regarding triage band and shifting the patient to allocated area after triage. So मामा मौसी का काम यही होता है कि they should see the triage band. According to that, they should take the patient to the designated area which was we provided in the casualty as well as in the outside of the casualty. The code red, the band which are in red, the patient who is having a red band are solely maintained in the casualty. They are treated in casualty, but the other bands which not treated in casualty are yellow and green. Black is already told you in the assembly point. So yellow and green should be the mousy should take the patient to the yellow and green if they are stable enough from red to yellow. Arrangement of extra lining and bedsheet should be done by the housekeeping staff. Arrangement of extra trolleys and wheelchair also, and biomedical waste management to be carried out by the housekeeping. So after that, the vital equipment like O2 cylinders, cardiac monitors, ventilators, defibrillators, suction machine, IV pumps and poles arranged to be done by biomedical team. It should be done by biomedical team. Okay, and list with the number and distribution area to be maintained by the biomedical team only. So this is the very important part of the lecture, that KP once the designated role has been applied, and if they are doing it, so the load of the patient will be get easily low. Okay, the thing is that if the biomedical team is if the oxygen cylinder is finished or any cardiac monitor we need it at the time of mass casualty, so biomedical team should be ready with all the equipments and help the doctors. And the role of the store to provide the color banded and identity band for the triage. Extra MLC register should be there, not the regular MLC register here. Here we are talking about the extra MLC register, which is completely different for the code yellow, not the MLC register which used to do it in the casualty. And preparation pads, extra pens, and in case of mass casualty. Okay. Receival of casualties. See, the quick and thorough assessment of the victim should be there, should be done by the doctor in charge when the patient taking to the casualty, before taking to the casualty, and then he should do the triage. He should do the triage before entering to the casualty. Okay, I'll tell you in detail about the triage, what are the color and what are the responsibility, what color will define how much time it will take, and what are the categorized, and I'll talk you in detail in later part of the lecture. The rapid turnover of the patient and life and limb threatened take priority. Disaster paperwork. So what about the responsibility of triage nurse? So the responsibility is that the responsibility of triage nurse include perform patient assessment first, then reassess the patient who are waiting, and initial emergency treatment if necessary, initiate. Okay, and manage and communicate with patient in waiting room. So the nurses should see to it that if the patient is reassessing, so who are waiting or patient, when we say that patient is having a band of green, but later on the nurse is thought that patient having symptom which are fitting to the red, so nurse should inform to the doctor that some of the patient is having some symptoms which are aggravated now, and the doctor should so the sister should come and tell to the doctor that patient is having symptoms which are not suitable for the green. So the doctor in charge who should see the patient and advise the nurse to put the band which are fitting to their symptoms. That is why it is called management communication with the patient and in waiting room. Responsibility of triage nurse continued with communicate status of patient to a doctors and nurses. This is what I was talking about, how the nurses and doctors should communicate. It is when the patient coming to the casualty and he or her symptoms are fitting to a red, when you are treating to the patient of red and you are taking other patient to a green or yellow area, so at that place if the symptoms is more, then sister should communicate with the doctor that this patient who's you fitted as a yellow, he might turn into red or he might turn into green also. So you need to communicate dynamically with the doctor. Multidisciplinary trauma team and triage management. So here is the triage team. The triage team leader should be CMO, and the clinical triage officer is ICU or CCU manager, and head nurse, matron, and chief organization like nursing superintendent. triage is nothing but it is a process of managing the patient, okay, by which priorities are set for the management of mass casualty. So triage is method of quickly identifying victims who have immediately life-threatening injuries and who have the best chance of survival. Okay, it is talking about best chance of survival. Okay. The aim in a mass casualty situation is to do the best for the most and not everything for everyone. Okay. So the aim of the casualty situation is to do the best for the most, not everything for everyone. I am repeating, not everything for everyone. Okay. You need to be concise and you need to be prepared for that. Those who actually need care, then only you need to proceed to it. Okay. Other than that, you can shift the patient to a green or yellow area. So it's a dynamic process, as I just said. Begin at the point of wounding, occurs all along the chain of casualty care, occurs at the hospital reception and continue inside the ward also, and continuous reassessment of the patient. So after announcing the code, all team members are supposed to gather the triage area where it is near the casualty ramp, okay, and then assessment of patients to be started by triage team and tagging of the patient to be done by triage team only, followed by shifting to the patient to a designated area. Tagging, which I told you in previously only, that tagging should be done as per the patient symptom. Okay. Place patient in a main category is priority and priority among the priorities. Okay. So triage document, here is the short paper of a triage document which we follow in our hospital. We write the patient name, coming from. If the patient name is not known, if patient is not able to say, then we will write unknown 1. इसमें मैं लिखना चाह रहा था थोड़ा, ई लिखो ना, कंट्रोल. So this is the document which we follow in our hospital. So here we write name. If the patient name is not known or patient is not able to say, then we will write unknown 1. Okay. And we'll write the triage card, number card like 1, 2, 3, and here the patient coming from where he is coming from, or which ambulance he is coming from, or XYZ brought by any bystander or any relative. So we need to write here the person detail, okay, and the patient gender. And if you don't know the patient age or patient won't be able to say, then you can guess it and you can write according to that. And here you can write the GCS and what are the fragments are there. If the burning, if the patient is burned or any blast, ये क्या है, फ्रैगमेंट क्या है पता नहीं, GCS माइन, ठीक है. थोड़ा एक हाँ नहीं, इसको रब करना था, फिर से बढ़ाता था थोड़ा सा.
कौन सा रब करना था?
ये हाँ, एक हाँ, ठीक है. नेक्स्ट. So here we need to write the gender of the patient and date of the casualty. Sorry. Next is here we need to tick what are the reason for coming to the hospital, like patient having burn or any blast. If it is their burn, then you need to tick that. If it is blast, you need to tick that. And if it is other, you need to write other, like if it is patient, if the mass casualty recently in our hospital happened, like all the staff nurse were having a food in canteen in their hostel, and suddenly everybody has started having loose motion and vomiting. So they were total 15-20 staff nurse has been affected with that. So they come in a group. So we write it like AGE there. Sorry, AGE. So ये रब कैसे का कंट्रोल पी ना, इसमें रब का ये नहीं है क्या, ये वाला है ना, ठहरा, सॉरी. सो मैं चालू करता फिर बीच में से. So other, we need to write other. If the other diseases, like recently in casualty there were a mass casualty happened, the reason was that in the canteen in hostel of the nurses. They have eaten the food, and after eating the food they started having loose motion and vomiting, and there were more than 15-20 staff nurse was affected with that. So thankfully we handled it very well, and we write it in other like acute gastroenteritis. Okay, any casualty, it doesn't like only burn or blast ही होना है. It can be anything. It can be a bee attack also, like शहद का झुंडी गिर गया हो, या फिर it can be like with I said poisoning, blast or burn. And after that we need to write the general examination of the patient once we take the patient to the casualty or in the area of green and yellow. So wound assessment, if the trauma occur of like if it is a blast, so we need to measure head to toe and do the primary and secondary assessment. So, and then categorize here as a red or as a yellow or as a green or as a black. So categories, we'll discuss it in detail. Like red category is that there is a serious wound, resuscitation and immediate surgery. Yellow is second priority should be given, need for surgery, but can be wait for some time as immediate surgery is red to be taken. Green is a superficial wound or an ambulatory patient. Black is a severe wound or a death occurred. Okay. So category 1 is nothing but a red patients who's having red band. Their management should be done within 20 minutes. Okay. And or the category 2 is the yellow, their management should be done within 1 hour, and category 3 their management should be done under 3 hours, and the category 4 is nothing but a 5 minutes, within 5 minutes. Category 4 contains who they are the black people who are either they are very severe or they are dead bodies. So if the patient is having dead body, then we'll shift the patient to the designated area, which is here in Andhra hospital. We have assembly point. So once the patient here is you can see the triage team is here standing here. Here is the entry point. Once the doctor and the staff nurse decide that this is having patient a red, then he will tag it here red and shift to a immediate care area casualty. If the doctor and sister have decided that these symptoms can be managed within 1 hour considering category 2, so we'll put the band yellow. Here we'll put it here, like you can see here, delay care. And the fourth is that walkable patient. The patient is walkable, then it is considered as a green category, and we'll put it a band of green, and it will be a category 3, and we'll shift it to here. And the last is if the patient is having very severe wound and it can't be managed within 5 minutes, so we shift the patient to either to a very immediate care or to the death bed. Okay. So here is a checklist of code yellow. You need to remember it for the rest of your life, that once the mass casualty occur, these are the points you need to remember before assessing code yellow. Every doctor should remember this. Once the code yellow has been announced and you are the doctor who is fetching the patient over the disaster area, so before coming to the hospital, you need to inform to your team in casualty that pre-arrival plan should be managed. What are the pre-arrival plan? The doctor should check the preparedness. They will the doctor should check the preparedness, like the doctor should tell to his team to see for oxygen. See the oxygen suction machine is working. Bag and mask should be prepared, and intubation tray should be ready. Intubation medication should be ready, and defibrillator and CPR board should be ready. And considering that if there is any burn or any proper trauma is there, and then you should order the blood bank. You should inform to the blood bank that considered amount of trauma is coming, so you need to be prepared. And assessment of the airway team should be that they need to assess the airway. IV or IO access should be taken, and primary survey, This is the primary survey which we will discuss later, and this team leader should be there. So team leader and team leadership should be available in hospital. Sometimes the mass casualty occur in the night or in the later part of the day. Then the team leader is not there. Then you need to call them. You need to for telephonically tell them that there is a mass casualty has been occurring in the XYZ place, and the patients are might come to our hospital, or they are coming on the way to our hospital. So you need to be come and be prepared for the team, and this is the pre-plan. This is the pre-plan should be done. After briefing the incoming patient and estimating the weight, you can't say judge that के patient का weight directly होगा, you can estimate it. So based on this is the pre-arrival plan. This should every casualty doctor should remember it when she is fetching the patient. So after the patient arrival to the casualty, so this is the survey you should do, primary as well as secondary survey. What are the things coming under primary survey are airway, breathing, circulation, deformity, exposure, and re-evaluation, monitoring, and vitals. Airway, it's a initial part of the primary survey. You should see the patient airway is protected or not. A patient tongue fall is there, or any foreign bodies stuck in his mouth. So you need to confirm that airway is protected or not. If it is protected, take it here. Yeah. And second thing is that you need to see that if patient is blast, if there is any blast occur, any trauma occur, any mass casualty occur, and you need to first protect the C spine of the patient to immobilize it. Why? Because if it is not protected, then patient might go in the paralysis, might go into quadriplegia. Okay. The B is the breathing. Okay. And place of O2 mask, or connect the existing mask to the O2. It's patient saturation or patient oxygen level. If you find that a patient, once the arrival of the patient, if the saturation level is dropping but airway is also clear, then see to it patient is getting enough oxygen or not. So you need to apply O2 here. Okay. And tick it. Okay. Third is the circulation. Check the pulse, the radial and the central pulse. And if the pulses are okay, there is no any weakness, or if you find there is no any bradycardia, then there is no need to tick. If there is a sorry हाँ last C वाला लेता हूँ, बहुत हो गया. And the C point is a circulation. Okay. In circulation there is a check-in pulse, establish IVO access, considering the ordering of blood. So checking the pulse, if you check the pulse, tick it here. If the pulse is normal, if the pulse is not having any irregular beats or irregular pulse, the pulse is normal, the pulse is within 60 to 100, then you need to tick it here. And if it is not, then if you feel that it is having tachycardia, you need to assume that the patient is having some hemorrhages also. So according to that, you need to deal with it. And the second is establish IV and IO access. If you didn't find IV access, then go for the IO access and tick it here. And third is considering ordering blood also. एक दिन में इतना पूरा पढ़ाना है क्या? ठीक है. The fourth is deformity. You need to see through a deformity like state of GCS. Patient GCS should be monitored in the casualty. See to it that eyes he's responding to your command, or his eyes are open, and his verbal, you need to observe the verbal. If patient is GCS is less than 3, then less than 7, then patient is coming in the category of intubation and emergency management. If GCS is going more than 8, 10, 12, then you can manage, you can put the patient in yellow and wait for it that the patient GCS should not get down to less than 10. Okay. And state of the pupil size should be mentioned. If the pupil size is pinpoint and patient is not responsive and GCS is dropping, you need to immediately call to your senior or call to any surgeon or a neurophysician to look to it. Is there any sign of head injury? Okay. The fifth is emergency exposure. Okay. Exposure. Completely removal of the patient's cloth and cover patient with warm blanket. If the patient's cloth is is wet or is having any burns or something, so you need to remove it and you need to tick here, and you need to put any warm blanket if it is having any cold or any you can say, बहुत डिटेल है भाई, मैं नेक्स्ट फिर से शुरू करता हूँ. Exposure is nothing but you need to see completely, you need to see the patient clothing if it is thrown or something. So you need to completely remove it, and if patient is having cold, then you need to apply the warm blanket. And the re-evaluation should be done. Evaluation, that re-evaluation is that if the state of GCS is dropping, then you need to see that the patient need intubation or not.
वो जब आ रहा है ना राइट क्लिक का, तब कुछ बोलो मत, तो कट
कट, अच्छा ओके,
तो
वापस से अभी वापस से बोलता हूँ. Now the sixth point is re-evaluating the airway. Okay, the evaluation need to be for intubation only, because here we see that if GCS of the patient is decrease or the pupil size is pinpoint or pupil is dilating, then patient is not responding. So at that time, see through it the patient is saturation level is dropping or not. If patient saturation level is dropping, then you need to immediately intubate. If it is not, but GCS is dropping, then electively intubate the patient for airway protection, and report the ET size and depth if available, and confirm the ET's insertion or not through ET-CO2. The last is the monitoring and the vitals. Monitoring is that confirm the heart rate by display and pulse oximeter, and the vitals, which are heart rate, respiratory rate, blood pressure, oxygen saturation, temperature, should be maintained within normal limit. Okay. If these are the categories the patient are filled and the patient is not requiring any intubation or any emergency management, then we put either to the yellow band or a green band. Okay, this should be done before taking the patient to the casualty in emergency ramp itself. And the secondary survey should be done in casualty. Here, once the patient is arriving in casualty, you need to evaluate from head to toe. Here from head, or if you find any deformity at the head, you need to mention here in the ears, eyes, facial bone, nose, mouth, neck or C-spine, chest, abdomen, pelvis and upper extremities. You need to log roll the patient for back examination. The last second is the plan of care. Plan of care here is you need to determine the laboratory investigations which is necessary. Routine investigation should be done with X-rays if required, CT scan or any notification to the PICU notification should be done to the pediatricians. Department and the last is when the patient is discharged from the department, what are the things you need to point it out. That first is the patient state of designation, where to be departed. If the patient is in a categorized of red, and he or she may require surgery within a few minutes, then you need to inform to the OT that this patient requires surgery, he has XYZ issues, and you need to correct it in the OT itself. So you need to state the patient designation and then prepare for the travel, like equipments of O2 cylinders and monitors, medications which are ongoing medications, and identify who will be travel with the patient. So designated area for the patient for after triage for the red band will be in our hospital. It is casualty bed and 5 OPD beds which are next to the casualty. And apart from that, for the yellow band or yellow area, the area will be the trolley area near OPD area. The OPD and the trolley area, their patients we can manage over there. And for the green will be the MRI रैम्प एरिया और ब्लैक बैंड विल बी अप्लाइड. देखो ये जो है ना, इसको कट करेंगे थोड़ा, ये नया बनाया हमने येलो का और ग्रीन का, इसको एडिट करना पड़ेगा आपको. येलो जो बैंड है ना वो ओपीडी के बाहर है, इनसाइड द ओपीडी, एंड येलो ग्रीन बैंड जो है आउटसाइड द ओपीडी इन द वेटिंग एरिया. होगा?
उधर क्या क्या लिखना है वो आप
लिख दूं क्या? लिख सकता हूँ अभी?
रुको रुको रुको.
हाँ. बहुत फास्ट तो नहीं जा रहा हूँ ना मैं? मेरे को कुछ समझ नहीं आ रहा, मैं चुप चुप चढ़ रहा हूँ। एक बार देखेंगे, अगर नहीं समझ आया तो रीटेक ले लो तो। ठीक है,
कहाँ करना है?
येलो बैंड को ना येलो कलर करो। हाँ,
और उसको येलो।
हाँ,
और ग्रीन को
ग्रीन करो। हाँ, ठीक है। यहाँ पे येलो बैंड पेशेंट मैं लिखूँ, येलो, एक मिनट, हाँ, बैंड, एक मिनट, कैजुअलिटी से कॉल आ रहा। हेलो,
हेलो।
हाँ,
हाँ सर, आपको यहाँ पे इमरजेंसी है कैजुअलिटी में।
क्या हुआ?
इंट्यूबेशन है।
अरे बाप रे,
अंजलि मैडम भी आई है, बट मेरे को फोन नहीं रहा, उन्होंने बोला आपको कॉल।
ठीक है, मैं आ रहा हूँ, आ रहा हूँ, आ रहा हूँ, हाँ, आ रहा हूँ, आ रहा हूँ। ये पेशेंट मर रहा है। सॉरी, मेरे को जाना पड़ेगा, नहीं तो मर जाएगा। वो लोग को नहीं आ रहा इंट्यूबेशन करने, अंजलि को भी नहीं आ रहा ICU से।
तो
मैं हूँ,
स्टॉप कर दे।
हाँ, आके देखेंगे क्या थोड़ा?
हाँ।
जज़ाकल्लाह।